Good morning. You're listening to Central Wisconsin's 24-hour information station, AM 1320 WFHR. It's time now for the Morning Magazine, brought to you by Comfort Air Heating, Cooling, Plumbing. Now, with the Morning Magazine, here's Carl Hilke.
Thank you, Jerry, and good morning, everyone, and welcome to today's show on AM 1320 and also on the web at WFHR.com. We also welcome our friends at RCCA Media, who are here digitally recording our broadcast for later viewing in high definition on the Solaris system and standard definition on your charter system or in high def anytime you want at their website, RCCA Media. And it's time for our Wood County update. Lance Plimmel, the Wood County Board Chairman, would normally be here. He's unable to be here today. But in his place, he was able to get Kathy Roetter, the Director of Human Services for Wood County, here, and Brandon Vruwink, who's in charge of community resources. And we're going to be talking about an interesting program Wood County's going to be kind of a leader on. And so first off, to both Kathy and Brandon, good morning. Merry Christmas. Thank you so much for filling in on short notice.
Well, good morning to you, Carl, and thank you for having us. We're pleased to be here.
Okay, let's talk about something that happened at the last county board meeting that was approved for the purchase of the old River Block building. I guess that's what it's known as now. I still remember it as the Consolidated Papers corporate headquarters. But people are wondering, what does that mean? And especially for human services. What's the game plan right now, or is it in development? And I guess you have some information you'd like to share this morning.
Well, the Human Services Department is excited with the purchase of the River Block building. As has been talked about, the Human Services Department came together in January of 2011, and prior to that was two separate departments, Social Services and Unified. In bringing the departments together, the thought was we could service customers better, also have greater efficiencies by operating as one department. And we have instituted some of those efficiencies in that, but we've been limited because we're located in 3 different locations currently. And so the River Block sort of is an element of the dream of bringing all of human services together in Wisconsin Rapids under one roof, so that customers will only have to go to one location instead of 3 different locations. What we're envisioning is that all of the human service area in the courthouse, which is primarily family services, some of our fiscal offices will be moving into that, as well as the services we provide on 12th Street, which are services for individuals that have mental health, substance abuse issues, and we provide a lot of children's services for kids that have developmental delays. So all of those staff will come together. And then lastly, our other location is currently in the Centralia office. And we provide a lot of economic support type services, as well as transportation and a variety of others through that location. So by coming together under one roof, we will achieve some economy of scales and greater efficiency, better services for the Wood County residents that we provide services to.
In other words, if someone needs to see 2 different aspects of your department, they don't have to go across town. It's just go down the hallways and see that person.
Exactly. One-stop shopping, so to speak. And I think our clients will appreciate that very much. Currently, they sometimes have to go between 3 locations, depending upon what services they're trying to access.
And I would think this will reduce costs for administering these programs, because when you have those different locations and paperwork flying back and forth and what have you, you got chances for mistakes, you got duplication, maybe unintended duplication. Mm-hmm. There's all sorts. I would imagine you figured into your budget, we're going to be saving some money here.
We anticipate we will, and we also anticipate better quality of service. Communication flows very differently when you're all in the same building than when you're in 3 different locations. So we do believe there will be some cost savings as well, and we're looking forward to that and being a little bit more streamlined.
Are you going to be able to do something at the new location that you can't at all these different locations now?
Well, one of the problems we've had at a couple of the locations is we're tight on space at this point, and we've had some significant growth in programs and need to add some additional staff sometimes. And so literally we have been doubling up staff into offices, squeezing into little closets, converting them to office space. So for the first time, I think we'll have an environment that's going to support the work we do, and we're very excited about that.
Okay. Yeah, I would imagine. And then also there's, when you want confidentiality, you're visiting with a client. That's not too conducive to developing a relationship,
Well, you have to sort of gauge, I think, in terms of the offices and who's in there when, if they're seeing clients and that. And I mean, it just adds to the inefficient workflow, basically. So this will really be a help.
Okay, now, Brandon, why don't you tell us, describe for our listeners and viewers out there your responsibilities in an interesting program.
Well, sure. I'll start with just sort of, Kathy talked about our Centralia Center location, and that's primarily where I work out of. And we have our economic support programs, our employment and training program, our transportation program for the elderly and disabled. So we coordinate all those services primarily out of our Centralia Center office. And we also do have our location in Marshall where we offer the same services as well. But so I oversee economic support programs such as food share, badger care, child care assistance, and then also our employment and training programs, which is food share employment and training, which is a program that has changed over the course of the last 9 months. Effective April 1st, we went into a regional model. And Wood County developed a partnership with CW Solutions, which is a private employment and training provider. So we developed a private-public partnership, which is a new model and a new way of delivering services. And so we provide services now in this area from Adams County all the way up to Vilas County in a 9-county area.
Okay, if you're just joining us on the Morning Magazine, welcome. We're getting our Wood County update. Kathy Roetter and Brandon Vruwink are here. Kathy's the Director of Human Services, and Brandon administers a number of community economic resource or training resources. Okay, so this new model, this public-private partnership, how will it affect clients?
Well, we've been in operation for about 9 months, and we've seen a positive impact for our customers as there's more resources available to them. So we've been able to enhance the service delivery that we have provided in the past and provide more resources to them. So we're doing a number of more workshops in helping folks locate employment. And we also have more technology available. We have a website that's available to our customers where they can go onto an online job board that is updated daily with what we call hot jobs. So different resources and different ways of thinking about it have really enhanced our service delivery.
Okay, well, then I would think this is very positive, that job board for the business community, because one of the complaints I've heard from them is, we have jobs, I can't find the people I need for the job. And I would think with this kind of a regional approach and using technology and the like, you're going to be able to help fill that need and get people the jobs they want.
Yeah, and the environment is much different, from even 2-3 years ago. There's a lot more jobs than there was 2 to 3 years ago.
Sure.
And, we didn't used to see signs on marquees now hiring because people didn't have to do that.
Right.
There was, a demand, a lot of workers looking for work, so the jobs were easily filled if someone did leave a job. But now we're seeing the employers need more employees. So, we take another approach where even, if I'm driving in a car and I see a sign in a window or I see something on the marquee that says now hiring, we take that and post that job on our website. So just to try and give our customers access to jobs that aren't advertised anywhere.
And it will help transition these people from, programs that support them to independence quicker, would it not?
Absolutely, and that's our goal is to help our customers move forward and take that next step. So as far as helping them get a job, or if they have a job, hopefully a better paying job. We also provide educational services. So if somebody doesn't have a HSED or a GED, high school diploma, we're able to help them go through that process of getting a high school diploma or a high school equivalency diploma. And it's very hard to get a job if you don't have a high school diploma. So that is really a significant step. We also work on connecting folks with short-term certificate programs. One of the aspects of our program is we have a partnership with Mid-State Technical College and Encourage Community Foundation, and it's our Pathways program, which is an innovative program that offers short-term training to food share recipients. And one of the models that we have is a CNA gerontology certificate. So it's a semester-long program that folks go through to get a CNA license, but they also get a background in gerontology. And as you know, in our area, especially in Southwood County, we have an aging population. We have a number of assisted living homes that are, continuing to grow, and there's a demand for CNAs. But the CNAs that graduate from this program don't just get a traditional CNA; they also get a gerontology certificate, so they're prepared to deal with dementia patients and ultimately provide better care.
Is that going to be, folks? Is that going to be the trend? These kind of partnerships and these kind of quick turnaround type training programs in the future. Do you see that?
I think the partnerships that you're identifying is really here to stay. We've entered into probably our department 3 or 4 different partnerships over the last 4 to 5 years. Some are with other counties, some are with private industry, a variety of different ways. And our world is changing rapidly. And there have been a lot of changes in terms of how human services are delivered. We had family care kind of start some of that early on, back around 2000 or so.
Right.
We then worked with a planning process and helped with a partner we have, Community Care Wisconsin, and we also have an income maintenance consortium with 11 other counties. So, we have another program, Comprehensive Community Services, where we work with Portage County. So there's a variety of different ways, but clearly services are moving to more collaboration, more regional in focus, with the hope of reducing some of the administrative costs that sometimes come with separate programs, each county operating, and by bringing them together, you have some efficiencies in that as well.
And make them more effective.
Exactly. And more expertise than you can tap into as well.
As you transition into the River Block building, when will you start doing that?
Well,
is there a schedule?
There is not a schedule as of yet. The most I can share with you right now is that once the closing is done, we will be able then to start taking some of, for instance, the Human Service Administrative team through that to have a tour. They've not seen the inside yet.
Okay.
So, and I have staff that are extremely anxious and want to see that. So after we can get people in to really look at it and get an idea, then we will sit down and start having, I'm certain, probably weekly planning sessions, trying to figure out how we're going to bring those services together under one roof. What services should be side by side, what may be in a different part of the building. All of that needs to be done.
Well, Brandon brought up a question as I was listening to you, the use of technology. As people going online and checking job postings and the like. Are you going to have to do a lot of retrofitting with that building, or is there an technological assessment of the building going on right now to see what kind of work needs to be done so that you folks can continue doing what you're doing at your current locations?
We have a wonderful technology department with the county, and Amy Kopp, the director of that, has been actively beginning to look at those issues. So I don't have any firm answers, but that is already being explored, and I know we're going to look at fiber getting moved over there and a variety of different things.
Okay,
so.
Because the reason I want our listeners and viewers to understand there's a lot
yes,
involved.
There is.
And it's not just, okay, let's go pack up and move. It takes time. It takes planning, like what
Absolutely.
floors you're going to be. It's a multi-floor structure. It's a pretty big building. How many employees do you anticipate having in that?
The Human Services Department will probably have somewhere between 115 and 120 employees. In addition to that, there are some other departments that will most likely move into the
Sure.
river block. There are some issues at the courthouse that need to be addressed in terms of space. And some problems with areas where, for instance, IT and emergency dispatch is located. So as we move out, it will open up opportunity then for other places to get some of their space needs met. At this point, which departments will move over there from the county have not been identified yet.
Brandon, from your standpoint, what are you looking forward to with the change?
Well, I think Kathy really touched on it. Right now we're in 3 different locations in the south end of the county, and we've got staff that connect on various different things that we work together on, and we do that by phone and do it by email now, but sometimes it really is nice to be able to work together that way, but also to bring our customers and clients, where we have 3 case managers, or a social worker, a case manager, and perhaps a therapist that's working with the same person. It'd be nice at times where all 3 people could get around the same table with that client and have a discussion, so we're all making sure we're working on the same direction.
I'm glad you brought that up, because that was what I was thinking of before. I mean, if you're dealing with an individual that has multiple needs, it'd be nice if you could all get together at the same table at the same time, so that person only has to make one appointment. And you can, okay, here's our game plan for this. You're going to do this, you're going to do this, and do this, and any other question, and they get on with their life. And so it sounds like this will be, it will, like you said, help your clients. It will help taxpayers, and I would imagine it will help the morale of the employees that have been closeted.
I think it will, and I also think it will help with some of our goals as an organization. We want to become more trauma-informed, which is evidence-based, work with clients, and we also want to connect in different ways. As we connect and communicate in different ways, that can only benefit the customer at this point.
The changes that the state has approved in a variety of different programs, social service programs, in the last budget, how is that going to affect you, or how is that going to affect the citizens of Wood County going forward?
Well, I think there weren't quite as many changes in this budget as the last budget for us, and we actually received some additional funding for mental health, which is in desperate need of funding.
That's one of the issues I wanted to talk to you about.
And we're seeing the numbers of individuals wanting services increasing. Unfortunately, there are not enough resources within Wood County to meet the need at this point. We're also in the process of undergoing some changes up at Norwood, our inpatient facility as well. We're recruiting for psychiatrists at this point, which are very hard to find. We're working with a company and have a couple of leads at this point, but we'll have to wait and see if they work out or not. But the need for a variety of very specialized professionals is a challenge, and having them relocate to this area as well.
Well, mental health issues are have ascended to number 1 in many ways. You look at a variety of different problems. Someone can't keep a job. It might have to do with mental health issues or alcohol or drug dependency issues. So until you get to the core of the problem, you can get them any job they want. They're not going to be able to keep it. So
you're absolutely right, Carl. Healthy People Wood County does an assessment of needs of Wood County residents, and repeatedly, I would say in the top 3 are mental health issues as well as alcohol and drugs. And we're seeing a huge resurgence of heroin in this community. And creating a huge amount of problems, and trying to have resources available to get individuals treatment is a challenge as well. And that is something the state did do in this next budget. They're going to have 3 regional heroin treatment centers that counties will be able to get individuals to in that, but that's in the development at this point. So
okay, going forward then into the new year, obviously the big challenge now is to keep your programs running while you transition to a new building and all the planning involved with that. Brandon, how are you going to be dealing with that in your area at the Centralia Center?
Well, I think we just take it a day at a time and begin to really think strategically about what's going to work best. And if we keep our focus on our customers, things will continue to move forward positively. But I think it's about being transparent and educating the public on sort of where we're at with the process, and that will all come with time. But yeah, we're taking it day by day and thinking about the future and how it's best going to serve our customers.
And
I would just add too, Brandon actually has some experience moving a program. He moved from the Johnson Hill building at one point into Centralia in a blizzard at the end of the year, right after the holidays. So he's got some good experience we'll tap into. But in addition to that, we do have a crisis line, and we will have phones available. This will obviously have to go in phases. Not every department's going to move. So, I mean, we will have resources available to meet needs of clients as they come up, even through the move. I mean, we will still be available.
And I'm sure you'll be using the various media, including this radio station, to get the word out to the public. Hey, we're in phase whatever, and here are the departments moving now. And if you're dealing with this department,
exactly.
But in the long run, it will make things, it sounds to me, a lot simpler and easier for the people you serve to understand where they need to go. And it should make for a more efficient delivery of services and more effective programs. Is that the bottom line?
Bottom line, and our phone numbers will stay the same.
Okay,
so people don't need to worry about that either.
Okay, I'm glad you brought that up because everyone's going, does that mean my phone number I have is out of date? Anything else before I let you go?
Just that we're grateful for this opportunity to begin the discussion, and we would definitely like to be involved with you and the public as we go forward in terms of planning, so that they're well aware of what's happening.
Well, you're welcome to stop by again anytime if you want to talk about your individual programs, or you want to talk about a specific issue. The young lady out there is my wife and my producer. She'll gladly book you on a show, or we'll get you on a community spotlight during the noon report. But we'll keep this discussion going because I think it's an important discussion.
Very much so.
Because people, on one hand, taxpayers want efficiency out of their tax dollar, and we also want to see our neighbors helped and back up on their feet and living a happy life. That's what we all want. Well, to both of you, thank you again on short notice for appearing on today's show. And to you and everybody at Wood County, a very Merry Christmas and a Happy New Year.
Thank you, Carl.
Merry Christmas to you and Happy New Year.
Okay, and that's Kathy Roetter and Brandon Vruwink. And that wraps up our Wood County segment here on the Morning Magazine on AM 1320 and WFHR.com and RCCA Media. The Morning Magazine, as always, is brought to you by Comfort Air.